Hi there, this is the second of 3 short videos looking at some of the economic aspects of healthcare in the UK. In this one we look at some of the arguments for and against state versus private healthcare provision. Should healthcare be provided by the state free at the point of need, one of the founding principles of the NHS, or should markets play a bigger role over time? Well, these are questions that involve making numerous value judgments. A free market economic system typically would fail to allocate an appropriate level of economic resources to healthcare, and there would be several situations of market failure inviting some form of government intervention, in particular in providing and funding healthcare in most countries. Healthcare spending in the UK has increased since 1997. This chart provides some evidence for that, although spending in the public sector, the NHS, has increased at a faster rate. So in 2016, £137 billion spent on public sector healthcare compared to just under £30 billion in the private sector. The vast majority of NHS funding ultimately comes from central collective taxation, such as income tax, VAT and national insurance. Well, healthcare issues are rarely far from the news headlines. Here is just a couple of recent ones about the NHS needing several thousand trainee doctors a year. The number of GP surgeries fell by nearly 2% last year, and common newspaper headlines about bed shortages causing cancellation of surgeries and increasing waiting lists. Scarcity and rationing are facts of life in the NHS, and this is part of the debate about whether the government should be perhaps encouraging more people to take out private healthcare insurance. A new survey by the King's Fund has revealed quite a lot of public satisfaction with the NHS, but actually a number of complaints. So let's look at some of the factors contributing to this. This is the graphic showing where the most common complaints with the NHS, and over half of the stated reasons were people saying it takes too long to get a GP or hospital appointment and there's not enough staff in accident, emergency, etc. Common complaints about waste and inefficiencies, but the number of people complaining about the quality of care or the attitudes or behaviour of staff are well below the wider complaints about the length of time it takes to get treatment. Waiting lists in the UK have been rising recently, again a reflection of increased pressure on NHS resources. Over 4.1 million people waiting for treatment in the summer of 2018. These figures reveal the extent to which the demand for healthcare, of course, exceeds the ability of a state-funded healthcare system to provide it. These are part of the debate about state versus private sector. So, what is the case for state-funded, state-provided healthcare? Let me provide you with 5 arguments. First of all, the crucial point is that it gives equality of access to key fundamental healthcare services, including maternity services, cancer diagnosis and treatment for many other illnesses and diseases. And crucially, the NHS does not base healthcare on people's ability to pay. That is one of the founding principles of the National Health Service. Second point is that a state-funded service can provide impartial advice, helping to avoid some information failures. For example, in the private sector, there can be an issue where the increased, or if you like, the knowledge, the information advantage held by the medical professionals might lead them to overprescribe treatment which is not necessarily required, particularly when it comes to, for example, private sector dental surgeries and things, or private sector cosmetic surgery. The NHS might be less prone to that kind of bias in terms of the supplier inducing demand in the market. Having a state-funded healthcare system paid through general taxation typically makes healthcare more affordable for the mass of the population. It means they have to spend less on healthcare, and therefore that can promote consumption because it releases resources to spend on other things. There's an externalities argument about having state-funded healthcare, in particular the merit goods, the positive externalities, the social benefits attached to affordable and widely accessible healthcare, again available free at the point of clinical need rather than ability to pay. And the large state provider of healthcare can also enjoy significant economies of scale For example, the purchasing of drugs. The NHS spends more than £7 billion a year in providing drugs, and therefore the large-scale state sector could actually be more cost-efficient than the private sector. It's also possible, of course, to have targets within the NHS. You don't necessarily have to operate in a private sector mentality, but the government deals with the absence of a profit motive for the NHS by monitoring providers' performance by a number of key performance indicators. Well, what about the private sector? How strong is the argument for saying the private sector could provide more in the way of healthcare? This table is a useful little bit of background knowledge. It shows the most owned private health and medical insurance company plans in Britain in 2018. For example, just under 1.2 million people owned a Bupa healthcare insurance plan. AXA, PPP Healthcare, Aviva, Third, Simply Health, Benenden. These are quite well-known private healthcare medical insurance companies, including Vitality and Saga. So there is quite a substantial amount of private healthcare in the UK. Healthcare insurance premiums have risen faster than inflation. If you take an index of consumer prices of health insurance, you can see that the index has risen from 48.7 in 2003 to 116.4 in 2018. In fact, healthcare insurance has risen by nearly 17% since 2015. So private healthcare insurance premiums tend typically to rise faster than the general rate of inflation. So what are some of the arguments? This is just a selection for the market via, for example, private healthcare insurance to provide more healthcare. There is a growing demand. In 2017, over £6 billion was spent in the UK on voluntary private health insurance. One argument is that in the private sector, unlike the NHS, you rarely have the length of queues or rationing or waiting lists that you experience in the state system. And that's because the market mechanism, of course, allocates more resources where demand and price goes up. The best health firms, if they're competing with each other, remember the chart showing those key leading healthcare providers, health insurance companies, the best health firms, the best hospitals, in a sense, are competing with each other. Perhaps that can drive excellence, quality of service for patients, innovation, and cost efficiencies in terms of procedures. So private sector competition, in theory, could drive competition up and costs down. That's a debate, of course. Providers in the private sector may have a discipline to cut their costs, keep their costs down, increase their efficiency, keeping premiums down over the long term, although we've seen those premiums have gone up faster than inflation. And the other aspect comes from the demand side, that if people know they're responsible for paying some or perhaps the majority of their healthcare expenses, it might influence their decisions on lifestyle, including diet, alcohol and smoking. Despite getting a lot of criticism at times, the NHS still holds a really high level in terms of other EU countries when it comes to affordability. The UK ranks actually second, just behind Lithuania, in terms of people finding healthcare affordable. Of course, that's fundamentally to do with the NHS. Look at Greece, however, deeply affected by the economic crisis. Nearly 2/3 of the Greek population, so they struggle to finance their basic healthcare. A huge problem there in Greece as per capita incomes have gone down. On to evaluation arguments. Again, the crucial point here is the NHS tries to ensure that every family and every individual, if you like, has access to decent quality healthcare when they need it, irrespective of their ability to pay. The debate between the free market versus the pure state government provider is often largely unhelpful. There's a lot of grey area these days, a lot of crossover. The NHS, for example, learns much from the cutting-edge innovation and research in the private sector. The private sector can really learn a lot from best practice within the NHS. So there's often a transfer of knowledge and ideas and expertise which is to be welcomed. Health insurance premiums have gone up faster than inflation, so if you move towards the private sector substantially, that could well cause an increase in the real cost of living for many people. And even if there is a shift to the private sector, the landscape of the UK will continue to be that the NHS is the dominant provider of healthcare in the UK. So the pressure really is about improving the efficiency of the NHS. That's the fundamental challenge facing the healthcare system. And perhaps we need to think about some of the alternatives. So perhaps an increase in prescription charges for basic medicines to avoid the risk of too many people asking for basic prescriptions as a kind of rule of thumb, matter of course. Should the NHS be raising more money by, for example, private hotel-style beds to provide extra revenues? To what extent should the NHS be encouraging health tourism, or be willing to pay for healthcare treatments of people coming to the UK? Should, in the long term, should there be a big rise in preventative healthcare funding, trying to reduce the incidence of obesity and other chronic illnesses and things, which obviously put a big pressure on the NHS across the long term? There we go, some of the arguments here for who should fund and who should provide healthcare.